Ladies and gentlemen, welcome and thank you for joining this session on Mindray's clinical assistive application called Balance of Anesthesia and how it can enhance the perioperative management in daily practice. I'd like to start this talk with a quick review of facts and figures from the Helsinki Declaration as it was launched back in 2010. It was reported by Melin Olsen and colleagues that 230 million patients worldwide undergo major surgery every year. Actually, the databasis for this figure is even a little bit older, from 2004. It has also been reported that about 7 million patients develop severe complications associated with these surgical procedures. And finally, on a global base, about 1 million, and in Europe, about 200 patients die. Looking at more recent data, Vesa and colleagues have estimated the global volume of surgeries to be roughly 312 million in the year 2012. And looking at Alkire and colleagues' modeling study of global access to surgical care, they state that 4.8 billion people are unable to access safe surgical treatments. And in the Lancet Commission of Global Surgery from 2015, we can read that about 143 million additional treatments are required each year. So the amount of surgeries related to complications is huge and further growing year on year. Let's have a look at some health factors that increase the risk for complications and the current prognosis of the development for these health factors. It is very well known that obesity is a big anesthesia risk and in the basis of many complications arising. According to the World Obesity Foundation report from earlier this year, they estimate that in 2030, about 1 billion people to be obese at a BMI of 30 or higher. This means that 1 out of 5 men and 1 out of 7 women will be obese. At the same time, the population is aging, and according to the United Nations population prognosis, in 2030, more than 1.4 billion people will be 60 years or older. Finally, looking at smoking, we have to note that despite the fact that less people smoke nowadays compared to the past years, still there is evidence that smoking exposes patients to increased risk of major complications and hospital mortality. Pierre and colleagues have reported this in their study in 2017 and impressively found that smoking increases the risk of hospital mortality by 20% and the risk for major complications by even 40%. When we talk about perioperative complications and consequences, we know there's a huge variety. And I would like to simplify and only mention a few general topics of patient-related complications and the generic consequences. We very well know, and there are many studies, that intraoperative hemodynamic instability or unwanted hemodynamic events are leading to increased length of stay and also increased mortality. Perioperative respiratory complications of any kind can prolong the recovery time, pose a need for reintubation or even unplanned ICU admission. Intraoperative awareness may lead to post-traumatic stress disorder, while on the other side, too deep anesthesia may cause a variety of unwanted results, mainly post-surgical nausea or vomiting, respiratory distress, hypothermia, only to mention a few. And post-operative pain can be linked to intraoperative pain and can develop to chronic pain. How can we prevent these complications and how can we adequately monitor the patient to support perioperative treatment? As a manufacturer, this question we are asking ourselves all the time, and we are researching on various methods to improve monitoring techniques. Looking at the survey among European anesthesists that was performed by a task force of Helsinki Declaration, we already see a strong coverage of many vital signs. On the left on this slide, we see standard monitoring techniques which are utilized in 95% or more of the institutions interviewed. From the table on the right, we see that it is also quite common to utilize advanced monitoring technologies like neuromuscular blockade monitoring or brain function monitoring, which is good. Looking at the literature, we all know that the balance of anesthesia is not a novel method. Actually, it was firstly mentioned by Gray in the 1950s, more than 70 years ago. And yet, it's still a valid and important tool to look at a patient's individualized anesthesia. Compared to the 1950s, nowadays, we have much more data at hand to judge about patient condition and measure a multitude of various vital signs that can show us unwanted changes in patient condition. Today, when I speak about the balance of anesthesia, I am mainly considering parameters like the BIS, bispectral index, or EEG monitoring for monitoring the hypnosis, a nociception index when looking at anesthesia, analgesia, and neuromuscular transmission monitoring looking at areflexia. On the following slides, let's have a quick overview of the advantages of these parameters one by one. The bispectral index, originally developed by Aspect Medical, now commercialized by Medtronic, has many studies showing its efficacy and clinical benefits. It can help to decrease anesthetic drug use, speed up the wake-up as well as recovery and extubation time, improve patient orientation capabilities on PACU admission, decrease overall PACU stay time, lower the incidence of intraoperative awareness events, and last but not least, improve patient satisfaction. Looking at neuromuscular transmission monitoring, we very well know it supports titrating the optimal dosage of neuromuscular blocking agents. So on the one side, we need to make sure the neuromuscular blocking agent dose isn't too low, which could be associated with no or not enough suppression of pain, surgical complications due to unexpected and undesired movements, difficult intubation, and complications associated to high pressure ventilation. On the other side, if the neuromuscular blocking agent dose is too high, we could face extended time to reverse effects, difficulties to wean ventilation and extubate, and hemodynamic complications associated to the high dosage of certain drugs. With regards to analgesia, we are utilizing the analgesia nociception index, short ANI, which is being marketed by the company M. Dolores from France. Several studies have shown its efficacy and clinical benefits, which could be the prediction of hemodynamic reactivity, the reduction of post-operative pain, reducing the post-operative numeric rating scale, as well as the post-operative nausea and vomiting score, saving analgesics, and last but not least, improve patient outcome and reduce length of stay. Now, before entering into a discussion, I don't want to debate on the aforementioned clinical benefits or clinical studies that are behind those expressions. I'd rather recap the main points that have been published and want to emphasize the importance of bringing all these parameters together. And this is the novelty I'd like to share with you today. All the aforementioned monitoring techniques can be combined in Mindray patient monitoring systems. Moreover, our brilliant engineers have developed visualization tools that combine the essential data of the vital signs in one screen, namely the balance of anesthesia dashboard. Here, with one glimpse, you can easily judge about the patient status, the visual indication and numeric values of parameters that are measured on the left bottom, the triad of anesthesia and patient-specific settings of the main three parameters that account for hypnosis, analgesia, and auroflexia on the top, and the recent trend data on the right-hand side that is associated to the perioperative procedure of the last 30 minutes to 2 hours. This fusion of various data into one screen can provide a holistic view of all anesthesia-related parameters and their dependencies. It can guide clinicians in optimizing the treatment towards a very individualized patient need and always allow a quick review and decision-making based on structured data representation. Moreover, the balance of anesthesia dashboard integrates an altered scoring tool, which provides objective criteria to judge whether the patient is ready for discharge from recovery. With an easy integration into the Mindray patient monitor, just a few simple clicks on the scoring tool will help to effectively make a judgment on the patient condition and then decide for next treatment steps. We believe this tool, Mindray's Balance of Anesthesia Dashboard, will truly support increasing patient safety within the anesthesia process and lead to an enhanced perioperative management now and in the future. I'd like to close this session with the following provocative sentence from Gabriel M. Gorman, which was distributed to all of you in the ESAIC newsletter from this year's January. It says, a stressful condition of the anesthesiologist could contribute to significant errors during routine activity in the operating room. While I personally don't want to comment on that sentence, I rather take this as a message and take this very serious and translate it into one of our core values at Mindray. Align with our customers. I truly believe it is the industry's obligation to develop the best tools to utilize available data and represent them in a way that eases the clinician's daily routine and thus could lead to less stressful conditions and eventually increase patient safety. Thank you very much for your attendance.